Sindhura. Yeah. So, all of us here, we would have visited doctors at some point in time or have been sick. Anyone who has never visited a doctor, please raise hand. Yeah, so practically everyone. So let's imagine how was your experience when you visit a doctor? How do you express your symptoms? How the doctor interacts with you and how the interaction happens with the medical systems where EMRs comes in. What we are trying to show today and what we've built at Eka Care is an end-to-end solution that solves three key challenges that we face today. One is the fragmentation of information and care delivery, be it right from taking an appointment or taking a vitals. The second is how easily and comfortably you can tell about your history rather than fumbling through lots of files, and how easily it can be collected, collated, and being displayed. And the last but not the least, we would want doctors to spend time with us and not with machines, writing about prescriptions, rather talking to us, counseling us, connecting with us. So the solution that we have built solves for all these three challenges. Obviously, thanks to the advancement in AI, we have been able to do a lot of this due to the capabilities that we have built in-house. So I'm going to narrate a story. This story is of Neeti. She's a 65-year-old female, has diabetes, and she wants to now see how she can do the whole end-to-end care delivery. To start off, Neeti is quite digital savvy. She actually has created her Abha address. Abha is the digital identity that India government provides. This digital identity allowed her to collect a lot of her medical records into the app, which is her PHR or patient health record app. She has also taken many photographs so that the AI can read through these photographs and collects her medical history in a digital format so that it can be summarized. Now what happens is Neeti wants to talk to an AI, which is a med assist or an assistant for Neeti. She goes ahead, she just picks up a prompt, says, summarize my health. What is happening now is all of Niti's health is getting summarized. You would know, Niti would know these are the kind of things that has come up from the medical records. Also, there is a prompt that Niti would get, which is very, very relevant to the kind of things that Niti is supposed to talk about. But today Niti came for a very different purpose. And now in a local language, she's talking to the bot and she's actually telling that मुझे बुखार है और घाव लगी है. In English, she's expressing that she has have fever and there is a wound in her foot. What AI would start doing now is try to understand more about this specific condition. Where is the wound? Is it swelled? Are there any kind of smell that is coming in? And all of this is happening in the local language that Niti understands. More importantly, it is not letting Niti to only type or talk. There are these prompts that are coming in that will ease off the interaction of a 65-year-old female. After collecting more information, such as mobile number, the AI would identify that this is an important case and this needs a doctor's intervention. But which doctor's intervention? With which clinic? On which date? All of this information will now get collected. This will be displayed. So in this case, Niti is being told that there is an availability of these two doctors on 14th of February, but she can always say that, okay, I want to do it in a different day. Pick up the doctor. As soon as she picks up the doctor, the appointments gets created. Neeti can actually do all of this by typing or by acting on the prompts as well. So this is how all the information that Neeti wanted to share with the doctor gets collected, gets summarized, and now appointment is created. The next story goes to when Neeti visits the doctor's clinic. And when Neeti visits doctor's clinic, this is a doctor's view where a doctor is looking at a classical EMR screen But how this EMR screen is fitted with these AI utilities that can help doctor to get the better outcome is what we want to demonstrate. If you see all the current EMR and the current prescription for Niti is completely empty. There is nothing there. Doctor is looking at the past history of Niti as well as what are the current ailments and current issues that has been listed. AI also ensured that it not only figures out the important information for patient, but here a doctor is also able to understand and get to know more about Niti, that there is an uncontrolled diabetes. There is so this is the kind of person that he's dealing with. But more importantly, it would be very hard for a doctor to start filling all of these information. During the consultation, doctor just starts the audio-based ECA scribe, which is now doing the interaction between doctor and the patient, recording the interaction between doctor and the patient. These interactions gets converted into medical notes, and these medical notes are verifiable medical notes that doctors would see. Again, this entire thing has come out just by the interaction between the doctor and the patient. Doctor has to just do copy to EMR pad. As soon as the copy to EMR pad happens, this entire information gets filled, whatever has been discussed, all the medication that doctors wanted to do. But here we go and see that during the consultation, doctor prescribed amoxicillin, but the patient's medical history said that he is or she is allergic to amoxicillin. The capable AI-based EMR is now alerting that the patient is allergic to it. Without actually going deeper, a doctor can very easily go ahead now and change this medication to provide for a better outcome as well as to reduce the medical errors. So it's changed from amoxicillin to clindamycin. As it changed, the prompt also changed. If you look at the information all filled, the PDF view of the patient will have the entire medications, everything created in the local language. There is a translation of all the remarks, advices, everything in the language that patient understands. And at the click of a button, this information goes and sits into the patient's PHR app, creating another node into her medical history that can be used for the further consultation and any kind of other ailments. So that's what is the power of AI and the utilities that we are seeing today. The care process, right from being fragmented to being consolidated, understanding the patient's entire medical history to making sure that the doctor's time is saved while he's seeing more patients and more medical data is captured. Today, all of that is possible. But yes, there are challenges. How to build these things at scale for multiple languages, how to generate that data so that your models are verifiable at those large scale. Who is evaluating these capabilities that are being built? All of these are challenges that we as a developers face. And I'm looking forward to building more and working more in this domain. Thank you very much.
Thank you, Vikalp. I'll ask you to take a seat. When you said, "Is there anyone who not visited a doctor?" Instinctively, I was asking, does veterinary doctor count? Because I'm a veterinarian by background. And then it's only a half joke, actually. In the pet care industry, there is real value and business to be made there. Uh, so just a thought. And on a more serious note, you could change the name of the lady and adjust age, etc. That could be my mother. And I deal with this personally as a caregiver, has all these conditions, deal with so many papers, and every interface you mentioned is a leaf out of my personal life. So thank you for thinking about building a solution here. I will invite my panelists one by one. Please join us on the stage. First, Dr. Richard Rukwata. He is the chief regulator He's the Director General, please. Director General of Medicines Control Authority of Zimbabwe. I have very high regard for regulators because I have been working on our regulatory agency and its streamlining, and I can see how difficult job that is. And the fact that you have seen this through for ML3 recognition, that's a wonderful accomplishment. Congratulations on that. Not an easy job. And also, you are involved in the regulatory harmonization work of Africa. And there is a lot of interesting thoughts you will be hopefully able to share in on this topic. Next, I would like to invite Professor Charlotte Watts. Last we saw was in G20. Hopefully, it brings back memories. Yes, happy ones. Like to keep it that way. She has had extensive career in both healthcare, HIV, gender-based violence, epidemiology, mathematics, and deep experience working in the government, UK government, which was the capacity she came for G20 meetings, which I was involved in from India side. So it's a pleasure to have you back, Charlotte. And now she's working at Welcome Trust as Executive Director of Solutions. Would love to hear more about how you are thinking about these things. And next, I would like to invite Dr. Monica Sharma. I happened to meet her just now, and she is the lead for Novo Nordisk India Foundation. And welcome. And her background is also in this both biomedical field, science innovation field, but also has extensive experience working in putting together funding programs, whether it is Newton Fund, whether it is IRTG, Germany's International Research Training Groups, or India's Biopharma Mission program. So all of these, I'm sure, will come in very handy in your current role, and would love to hear from you on thoughts related to the topic today. And last but not the least, my dear friend and mentor, Dr. Trevor Mundell. I should say Dr. Trevor Mundell. He is both a he has an unusual background. People who work with him smile when I say unusual. And Trevor, he did medical degree and then he figured he wanted a PhD in mathematics. So and he's a Rhodes Scholar and has extensive experience in pharmaceutical industry as from early research to development and decade plus experience in global health. With that, we will get started. Vikalp, where did he go? I want you here.
I thought that questions will be only for the.
No, no, will be, but you have additional things to add, so would love to hear from you as well. First, to begin with, so I think hopefully you all have mics. For me personally, coming here after having read the blog that went out very famously by CEO of Anthropic, I came in with a very bleak feeling, to be very honest. It's kind of depressing. What are we creating? But I have to say, last 2 3 days has been energizing. Seeing all the um, chaos in terms of interactions, people talking to each other, hustle, just hustle, and people excited about the product they're building. It brought me back memories of vegetable market where I grew up from, where people are like life there, right? So the people are trying to sell something, people are trying to buy something, people are talking, and the reason I talk about that as a happy thing is it's nice to see so many human beings. That's what came to my mind in this in the backdrop of that blog. So I would just love to hear from you. What was your feeling as human beings? I think this seeing anything that you want to particularly share last 2 3 days, you have been here, you saw all of this, what did that make you feel? because I think going forward, this feeling of human beings, I think will have a currency of its own. Anybody wants to volunteer and say something? It's an open-ended question. Yes, Charlotte.
I'm happy to jump in. Um, so I just got here actually yesterday.
Okay.
So I actually missed, I think, the early start of the week, which I heard was fantastic because you had the youth here, as well as older people who've been in the global health or the global sort of sphere or in the AI world for longer. So that mix and the drive of the kind of energy, I think, is what I was hearing people tell me about the start of the week. But now I've just been here sort of last night and today. And for me, what I feel quite reassured about, at one level, it's so, the change is so profound. And so I suppose I was sort of wary because there's so much hype. And then clearly the risks are being articulated. But what I feel reassured about in going to a number of sessions is just actually we're starting to have the more meaningful conversations about what this really means. That is getting beyond that either hyper sell or hyper fear to actually how do we navigate this space? And also how do we navigate this as a global community? Because this is not something that's one country's problem to fix. So actually I'm feeling that this is a really important conference, and we're starting to get into the we need and we're starting to get into the nitty gritty of how on earth we move forward in the best way that really makes the most of the opportunities, but really recognizes the risks.
Thank you, Sean. Anybody else want to share? Trevor and then Monica.
Well, Sindura, what I've heard frequently in this meeting, and I hear it quite often in the AI application space, is that technology is just 10% of the exercise in applications of AI. And the rest is really around people and ecosystems. And as soon as people say that, they then go back to talk about technology. So I am interested in how we do more than just pay lip service to this notion that we really need to think about the ecosystem and the people involved, probably more than the technology itself. And defining the actual role for humans in the loop is going to be, I think, as important as any of the technological advances.
So, Sindhura, I don't have an experience from the summit as such because I have just arrived here. But I want to share a very relevant experience from this morning. So, while I was coming here, I have a 6.5 years old who just saw AI on my computer, and he said, "Where are you going?" I said, "Yeah, I have a meeting to attend." He said, "AI," and I was like, "Ah." And I was like, "Oh, he's able to see." I said, "So you know what is AI?" He said, "Yeah, it's artificial intelligence." Then I said, "What else you know about it?" He said, "Yeah, soon there are going to be robots doing everything for us." And I was like, "No, but still you would need me." And I found like, oh my God, that's not a good start of a conversation. Like everybody is influenced by this. So thank you so much for bringing that human back to this summit. Yeah, that's what I thought I'll add as a conversation from my household this morning.
Thank you. Yeah. No, Charlotte, I hope you're right that there is a lot of hype there. Now I'm praying for hype. After reading, how many of you have read that what I referred to the blog by Deria Modi by Anthropexia? Raise of hands. Okay, okay, few hands. So I am not even sure whether I want to urge you to go read because it really makes you think. And there were some people who are in the field. They said I am choosing not to read it because I don't want to know. So it's a good thing to hear this human in the loop and the way we responsibly develop, because that's the theme we want to explore, especially in the context of health. That I think is a good segue, Dr. Richard. I want to ask you, start with you. Job of a regulator, I said, is hard. The reason I experienced it firsthand, having now very closely worked with our regulatory system, etc., where you have two extreme pressures on a regulator. On the one, it needs to move fast. It needs to be less. Like everybody wants it to be less regulation. And you want to speed up innovation, and every day gets counted and you're held to the metric. That's one extreme. The other extreme is, boy, if anything goes wrong, who is the first person who approved this, who allowed it to come out? So these are two extreme things, and usually in a slower cycle you are able to have some time. So how are you thinking about it in the age of both AI, but in general, in reconciling these two extremes of demands put on someone like you?
Yes, thank you for that insight. I have to think on my feet here, but you're quite right. It's a matter of industry wanting more results from the regulator for less investment, and also wanting to retain, or rather wanting the regulator to retain responsibility when things go wrong. I remember watching a very interesting podcast. I think it was called Moonshot. And in this episode, they were saying, well, if all the jobs are taken by AI, regulatory jobs will be the last to remain, because people should always have somebody to blame, right? We cannot say, oh, somebody was harmed. It's, no, AI did it. No, that would never work. So worst case scenario, I'll be the last person there so that they can hang me when something goes wrong. So at least I have that job security to think about. But really, with respect to what is happening in as far as industry's expectations are concerned, we see a lot of potential in AI. We're currently working with a grant from the Gates Foundation on an application for screening applications for marketing authorizations. I think those in our industry, the pharma industry, know that this is the biggest um, the biggest source of angst amongst industrialists, that regulators take too long, and we are seen as an impediment to progress, actually. So we also blame industry. We're saying, well, you submit incomplete applications and then blame it on us. So we're hoping that with technology we'll have applications in the near future that can work for both sides of the fence, right? Neutral applications that don't necessarily speak to one side, but they enable all of us to at least reach a common position very quickly. This is the beautiful thing about computers, right? They don't feel any type of way about you. They don't necessarily like you. They don't dislike you. So we're hoping that this will allow us to do
I was just
more
saying, not
as
yet.
okay. So we are hoping that as we work more towards the development of these tools, we'll be able to see more traction from industry so that we become a more efficient part of the supply chain, right? From development to market, and not to be seen as the barrier to entry in this field. Thank you.
That's very helpful, and also there is both a challenge for a regulator when this AI speeds up the cycle of innovation, brings new complexities, but also itself a very good tool in either summarizing a complex application or building models that allows a few people to actually have the same capability as a well-developed pharma, so be on the same page. So lots of interesting possibilities here, which in India we are also thinking about. Along those lines, all three of you are coming from one type of shared commonality, which is funding innovation. And as a funder of innovation, you are also, in not too dissimilar way, are trying to balance promoting innovation while upholding safety and minimizing risk, etc. So I would like to hear from each of you, because each of you are different kind of funders, uh, how you are thinking about balancing these two in the funding programs and scouring innovation and speeding that up. Uh, you can go in any order. You can thumb wrestle.
Trevor's pointing to me, but I went first last time, but no, I can go. Um, I mean, we fund, so I'm from Wellcome Trust. We fund a range of innovations with ambition of improving and saving lives. Increasingly, we are funding innovation in the digital AI space, along with partnerships to develop new products, drugs, and so on. But we're also a funder of generating evidence. And so for us, it's really important not only to say how do we develop a technology or something that can really make a difference, but also how do we generate the evidence around those products or the ways those products might be introduced into a system to actually help inform decision making and to inform regulatory partners. Because for us, that evidence not only, for example, on whether a new AI application, improves your ability to detect a particular disease or condition or diagnose or so on, or enables a clinician to deal with multiple sources of information. We also need to think about, well, what does that look like when it comes into real world use? What does it mean? Does it operate with the other parts of that health system? Does it create unexpected pressures? Are there underlying risks if you try and use this application with a particular age group or a particular socioeconomic group, for example? So for us, as a funder, for me, it's really important that we want evidence, because ultimately we want decisions and investments to be shaped by evidence that's really tracking things through from the opportunity to actually what's that look like in practice, and sort of have those feedback loops. But I can talk a little bit more about the initiative as we go along.
On the acceleration front, we look at it in that every month we don't have the next generation malaria vaccine. And certainly every year we're seeing hundreds of thousands of deaths in young children. Every year we don't have the enhanced personal coaching and education. We see a generation that is losing opportunities. So we feel a tremendous pressure, I know, from the funder side, in terms of how do we speed the availability, the access to a tool which looks like it might be a solution to some of those vexing problems. But I think that it really behoves us here to think about completely focusing on fast might be slow. And we have to have this moment of reflection. Because what could derail the good application of AI? You think about it in the health area, which is so sensitive, the few errors, like on the regulatory front, the relatively few errors that could occur, the unfortunate outcome for a patient, which can be attributed to a system which was probably misused by the people who are using it maybe, but nevertheless will be attributed to AI, and that leads to a tremendous deceleration and things not moving ahead. We take the lesson of the self-driving vehicles, where they may be incredibly good drivers and better than the average human at driving, but one fatal accident puts that whole enterprise at risk. So I think from the funder's perspective, we need to have a situation where maybe taking a little bit of a reflective and a slower approach might be fast.
Monica?
So I represent Novo Nordisk Foundation, and we support health, people and planet both. So at this point, sitting with funders, global funders, with yourself, and I think it sends a strong message how important AI is at the moment with respect to health. So while we are trying to address as funders different parts of the ecosystem addressing health, but having AI bringing evidence to this really matters. So I think I really feel that having a joint approach towards it is kind of strengthening the whole ecosystem of AI.
We didn't plant it, but that's a joint approach that brings me that's a good reminder. So today morning I was told a call went live. Thanks for that. It wasn't planted. So do we have a slide? Can that slide go up? So this call on evidence for AI in health has gone up. It is $60 million funding. and from 3 funders listed there. And the QR code allows you to look at it, and all the details I believe are there. I have not tried it. Uh, I would very quickly like to hear from any of you or all of you. What are you trying to, what are you hoping from this? And after this, usually panels, I find panels very boring, by the way. So, and as a person sitting there, or as a person trying to sit here and trying to give gyan in 2 minutes, so I would love to make it more interactive. So get your questions, and I want, there is still time. So right after this, hopefully I would like to see you interacting and sharing your thoughts and sharing questions. So I'll be coming to you. So who wants to uh, say your hope from this call?
So we're really excited about this announcement today. You'll see it's the big health research and innovation foundations coming together to jointly support what is a major initiative. And essentially, what we want to do here is say, how do we generate real world evidence on what does it really mean, and are we really seeing real world health impacts once we start to integrate AI into different health systems. So it's, we have lots of exciting opportunities that are showing the efficacy of particular application, but what this call really wants to support is rigorous evaluations of where AI systems are integrated into clinical decision making. Our focus is on low and middle income countries. We are interested in really asking a range of questions. What does it mean for the health system? Are these new initiatives actually operable? Can it be integrated into what often is quite a big bureaucracy of a health system? What are the costs associated with that? Are these interventions actually cost effective? In the end, ministries of health have to make decisions based on affordability. So how do we learn more about the costs of this transition? And what are the things we didn't expect, right? And what we see, if we look at the evidence base, we've got a lot of exciting evidence of interventions that show promise. We've only got a relative handful of rigorous randomized controlled trials that are actually assessing interventions when they're implemented. So there's a massive gap there. And then we're also now starting to see in different contexts anecdotal evidence of where AI has been integrated, but it's actually butted against the system. And actually that opportunity isn't realizing and sort of is showing it's easier said than done. So basically this investment is to try and address that evidence gap. And I just want to call out that JPAL is here and APHRC, who are key partners on this in supporting the implementation, and for APHRC, the contextualization of the work that we hope to be supporting in Africa.
Wonderful. Thank you. Anything else, Trevor, you want to add?
Well, I just want to say thanks to our partners at Welcome Novo Nordisk Foundation on this initial effort. I hope it's the start of even more in the future over there, because the global health world has been plagued by this lack of primary data. Us and others have funded a lot of modeling, simulation around global health problems, but you cannot transcend the lack of primary data at the end of the day. And AI is too important for that to be the constraint that impedes implementation at the end of the day.
Right.
So I thought maybe it'll be good to also add that how, as we funders together, envision this as a commitment towards shared standards. So while we'll be working together as part of this call, we are saying that the real world evaluation is not optional, it is the foundation. And by aligning together, we are kind of defining what good looks like, so that we reduce the burden on countries and developers who would otherwise face a patch of, I would say, patchwork of expectations. And secondly, I would say that by joining hands, we are reducing fragmentation in a rapidly evolving field. And now that we are coordinated, we are getting away with the risk of duplication, the quality that we want to see in the applications or in the products. And we make sure that the investments that we do are getting into the real world. I mean, they do create an impact because of the coordination that is part of this whole process. And I also say that when we sit together, it adds the seriousness to the ecosystem, that what we are doing is not a side experiment. This is something that we are creating as an infrastructure for a long term process that I would say governments have been asking for it. And the best part as a researcher, I would say, is that we don't, like, the researchers don't have to navigate three different timelines.
Of
No
the
three,
funders?
no,
Okay, yeah, that's
yeah, yeah,
there is hooray to that.
and no,
Yeah.
no three different criterias. We just have not like one agreed aligned criteria. And I would say that no three different deadlines, no timelines. So it makes really life easy as a researcher, I would
Yeah.
say. So yeah,
I
that's my
hope you get
favorite
some
part.
interesting calls from it. So, if we have questions, is there a mic going around? I hope there is. If not, I'll give you mine, so I don't have to say answer your questions. And please do. There is one hand up there. Please direct your question, including to Vikalp, if you have questions. So, yeah, let's start with the gentleman at the back, and then you are up next.
Thank you, folks. Very interesting. My question's around data privacy and data privacy by design. And the lady mentioned three different parameters. Could you elaborate more on how data privacy can be incorporated, at least at a policy level?
Anyone wants to take that question? At least in the context of this call, I guess you can, or in general.
Maybe I could give it a shot.
Yeah, how are you handling this, Vikal?
Yeah. So I think health data is quite sensitive, and I mean, most sensitive data rather, when it comes to country, when it comes to individual, when it comes to even places such as police, military, etc. So, and it's a pretty valid question. Some of the things that we as an organization try to follow is the general guidelines that has been provided by the competent authorities, such as be it HIPAA on the healthcare data, or DPDP, which is the Act for Data Privacy in India. And more importantly, if we look at the data exchanges, such as NHA in India, have also created clear guidelines. I think following those guidelines and getting yourself tested against those guidelines are fundamentally important. And it has become so sensitive that today a lot of our customers, they do ask us whether you have a continuous sort of applicable certificates from these privacy authorities, as well as these privacy based frameworks. So that's how we solve for it. And I
Yeah.
think it's a good thing. In health it is fundamentally critical. uh, and the technology, how it is growing, I think there are multiple other ways as well, like an end-to-end encryption and so on and so forth, where we can use it to keep things private.
So now I think there are two aspects to it. One is technological and another is policy. There are other sessions entirely focused on people who are working on it. So I wouldn't put you in the shoes to answer that. But on the technological front, both Charlotte, if you want to address, or Trevor, on what are some of the things, model learning without data being exchanged, or synthetic data. So many aspects of it which you have been in the forefront. And Charlotte, whatever you want to.
I mean, I just wanted to say, in terms of the evaluations that we want to support through this funding, we'll be very much expecting clearly on anonymity of, basically for those evaluations to adhere to high quality research standards. So the kind of bars and the checks and controls that you'd expect if you're doing any sort of research study on health, and the sort of ethical guidance and clearance procedures that you need to adhere to. So for us, that's just an important part of any aspect of research that we support and that we'll be supporting in this initiative. And that includes issues of privacy and other things.
You want to say anything about the technological emergence of any new technology that has been helping with preserving data privacy, but not the innovative learnings and improvements of the models?
Yeah, Sundara, so I think that for us, there's no compromise on patient data privacy from the clinical trial, as Charlotte has mentioned over here. But AI does raise a lot of other issues that go almost beyond that. So, for instance, the various models of federated learning that people have introduced, where you can have locally private data, but you contribute to the evolution of a model, which improves because it has access to a very diverse data source. Now, has that actually been regulated? We had an example of one of our grantees who produced a very good system for using ultrasound to diagnose certain chest diseases. And it was based on a federated contribution from different groups that kept their own data, local and private, but they contributed to the model. And that hasn't really been tested, and all of the policies around, is that a disclosure which is acceptable now in the age of AI? I think it's something that we may want to encourage with the right framework.
Thank you. And do you have the mic? Okay. Then if you have another mic, you can take it to the gentleman, madam, and then after you send it.
My question is to Professor Watts. You mentioned about clinical decision support. So the context from an Indian healthcare setting, as you're well aware, is majority of our health is run at the front line. So there's also an element of operational decision support as such. So there's a bunch of geospatial AI models that we are working with Google for geospatial inferencing in the tuberculosis space, mostly active case finding and then diagnostic network optimization. So my question is, from an evidence perspective, we obviously are doing some retrospective analysis, and we plan to follow it up with a prospective analysis as such, although it's a single unit right now in a city. But would this be of interest, and what is your level of inclination to operational decision support? Because I'm a physician myself, I'm a medical informaticist as a PhD. I can tell you for one thing for sure is the patients who come into the system, they for the most part taken care of, but those are all the silent patients who are out there undetected in the community. So what's your inclination indeed in this research grant for such solutions?
It's a wonderful question. And because essentially I come from public health, right? So our interest, I think our collective interest, is actually how do we, in particular, focus our evaluations and generate evidence where there's the greatest opportunity to improve health and to strengthen systems. And some of that aspect might be actually other opportunities to reach and improve care for the underserved. And so we're not going to say, this works and this fits and that doesn't fit, but ultimately we are interested in how does that integrate within a system. In the call, we mentioned the importance of looking at interventions at a primary care level, not only at tertiary care. And I think the things that will resonate in our interest is really are there areas where actually the opportunity is big enough that actually it merits that assessments to say, is this really translating into tangible health impacts? And is the return on that actually affordable? And is it something that could be scaled? So that issue of, how does it connect with the system is an important part of the question as well that we're interested in.
No, I do think it's a very important question because you're probably all aware of the constraints that we face now in the global health space in terms of funding some of the exciting new technologies that are coming along, whether it be at the level of the Global Fund or of Gavi, who both have not met quite the standard that we would like to in their replenishments. So there's just a reduced amount of funding available for those critical commodities that could be life-changing. And when we get a TB vaccine, which we hope we might have in, say, 3 years, how are we going to afford to actually put that out to the people who need it? So it's exactly the kind of targeting that you're talking about in terms of risk targeting that can make all the difference in terms of taking now the lesser amount that we can afford, but putting it to where the need is the greatest, and that matching, which the AI systems and that geospatial targeting that you're talking about, is exactly the solution that we need to promote and understand how it works.
Wonderful. So,
Yeah.
person who has a mic, and then
Hi.
you can hand it to the person back after you ask the
Okay.
question. Yeah, thanks.
It has been like a great session. So,
Yeah.
how do we go about building AI agents that are not only intelligent but reassuring in very high anxiety environments like maternal and infant care? How do we go about that? What I would love to hear your thoughts because we're building something on the same.
When you
So,
say high anxiety, just so that
high
I
anxiety
didn't
for
understand.
maternal and infant care because even myself as a new mother, I feel that there are a lot of open areas where the mother doesn't know what to do,
Mm.
right? And it's an open field, and the pediatricians, gynacs, and the mother support system is very low when you go down to tier 2 and tier 3 cities. How do we go about building there?
Mm.
I would love to get some thoughts.
You want to take it, Bill?
Yeah. So I think one of the things that we have done while we build a lot of these agentic pipelines for doctors, for users, is uh, having human in the loop while the development is happening is extremely, extremely important. And that's what Trevor also mentioned, because today, how this can go and where it can lead is not something that you can fully control. Uh, and so there are these systems that are specifically designed where an anonymous, de-identified conversations are practically being uh, distilled to see if the agents are working together in tandem. The second thing, and that's more technical, that we have sort of figured out is the models are quite capable, but when you are running them with a single goal or a single agent with a single prompt, that practically at times narrows down the whole worldview. But if you are running multiple agents collaborating together, where there is a grounding agent whose job is to make sure that the other agent is not sort of going beyond what the boundaries are, I think that is fundamental in healthcare. If it is just a single agent, single prompt, and a very and that's what we should avoid because it's a quite deep workflow, especially if we look at maternal health and things where the mental health comes into being. It's fundamentally important that we follow some good technical principle of creating a multi-agent architecture, but more importantly, have a human in the loop because we as a company hasn't been able to find a way to get out of it. That's why we have like a strong 10-member medical team which is also growing, where these are doctors working with the technologists.
Yeah, thank you. And unfortunately, sorry, I have been told we are out of time, but speakers will be available. If you can please come up to them. And one very quick thing just before we go, anything you want to share, what you would like to see next year when we come back to AI Summit? I just heard that it is being hosted in Geneva. Say we are all showing up there. We have all these aspirations. What would could look like when we show up there to say, okay, this year we did something together? Anything that comes to your mind?
You know, I'd love to see the next iteration of Vikalp's patient-facing agent. And that would be an agent that would be able to guide you in your health pathway, would be completely transparent, and that I would actually understand why it made its decisions. And I would have 100% confidence that, you know, in that anxiety provoking situation, it never made an error related to guidances, drug contraindications. It was always correct in those things. And I wouldn't have to be concerned about that. That's the next iteration that I'd love to see next year. Next year, maybe.
And
What I
maybe
would like to have next year is, instead of all of us as funders sitting up here, I would like to see some of the partners that we're funding who are doing work to really understand what this looks like operationally and to have really honest conversations about what's working and what's not working. And so we're moving away from the hype to really actually starting to get into the nitty gritty of what this could be and can be.
Okay, so quickly, I would like to see a situation where there's more collaboration between industry and regulators, because ultimately we're on the same side, we want the same thing, better quality, safe and effective medicines for all our people. So development in that area would be very exciting.
And
Final word to you.
I think I would still love to see that no matter how much evidence we generate from AI, no matter what we do, we still have that last word from the doctor who is sitting there, and never forget the human angle while we navigate the AI space. That's what
Okay.
I always want to see.
Thank you so much.
Veterinary or human?
Yes, thank you so much. Next time we meet, I hope we all feel as optimistic as we do, and some more. Thank you so much for attending. Yeah.
Thank you, speakers. Thank you, speakers. We just have a souvenir for you from India side for this session. Thank you so much.
Where we stand? Oh, yeah, yeah. Yeah. Okay.